Hello, I'm Alec Martinez. I'm one of the physical therapists here at Home and Rehab, and today we're going to talk about some of the treatment options that we may go through depending on what kind of vertigo you have. Like we've discussed in previous videos, vertigo can be caused by different things and can be diagnosed in different ways. So of course we're going to specialize our treatment to what's going on. One of the most important ones that we always check for, again, is orthostatic hypotension, that issue of blood pressure. Just to review, this would be a change in your symptoms if you move from a position like supine to sit and suddenly get a head rush, or if you go from a sit to a stand and feel very lightheaded. Again, this would be something that you want to talk about with your physician or your cardiologist in order to see if there's a better way to manage your current blood pressure or your cardiac output to make sure that there's nothing going on. Some changes might be, of course, a change in medication, but also changes in nutrition and exercise program may be important in order to help you manage this. One of the other things we discussed was that some vertigo may be caused by some issue with your nerves, whether that's a neuritis that's attacked the inner ear, peripheral neuropathy that affects your ability to feel your feet, or a history of stroke or TIA that affects your brain's ability to process the messages it's receiving. Now, the great thing about the nervous system is that it's amazingly plastic, which means that it can adapt to different things and help learn how to compensate for the deficits it has. One of the ways that we do this most commonly is what's called forced use, which is when you take your body and ask it to do the things it doesn't do so well already. You grade this in a way that allows you to perform it, but with some error, because the body's best way of learning is through committing some small errors. We do this through balance activities, or if you have issues with activities like turning your head and maintaining focus, we'll of course try that. People with issues with their eyes being able to focus on one object to the next will practice things like this. People with difficulty balancing on surfaces that change pressure will practice things like that. However, the idea is that over time we're going to increase the difficulty as you increase your abilities, so eventually you can do the same things that you did without having to put any conscious effort for. Now, the most exciting thing for people to hear about is that they have BPPV. This is the case that you have something within your ear canals, the semicircular canals of the vestibular area of your ear, that might have some debris in them causing you to have room-spinning dizziness. While this is one of the scarier kinds of vertigo because it causes the most intense symptoms, for most people this is one that you prefer to have because very often it can be cleared up in just a few visits. As we discussed, debris can go into those canals, which often means that it can be cleared out with a series of exercises like the Epley maneuver or the Gaffoni maneuver. These exercises are things that we're going to go over in future videos, but the idea of all of them is that we are going to be positioning your head in very particular angles for very particular sets of time to allow whatever debris has gathered inside the semicircular canals to slowly work its way out of them. In some cases, people have debris that is entirely caught in their ear, and while there are some procedures that we can do in order to attempt to rectify this, most often the first thing your physician will ask you to try is something called a habituation maneuver. Habituation is the idea that over time, your body gets used to certain things and that symptoms will decrease. The idea is that we're going to take some graded exposure, which means we start with something that kind of aggravates your symptoms, but allows you to recover very quickly. And we repeat this as long as your body tolerates it. Our goal isn't to make you feel terrible, but it's to slowly expose your body to something that it doesn't like. As your body becomes less aggravated by this activity, we're going to increase intensity, so again it gets a little bit aggravated. And over time we're going to climb that step, going a little bit and waiting for your body to climb down, stepping up the next and waiting for your body to adjust to that, until we can get to the same level as the average person will get dizzy. I always talk with my clients that it's very important to understand that everyone can get dizzy if we work too hard, but we want you to have that at the exact same level as the person who's standing next to you right now. So depending on if you need a canalith repositioning maneuver, if you need to work on habituation, or if you simply need to retrain your brain to better use its tools, we're going to provide you with a series of videos that helps you decide which ones are right for you and how to do them.